Yes.
My name is Tao Baidele Daniel. I'm the Editor-in-Chief for River State Medical and Dental Student Association,
Okay.
and I've been sent here by the Editor-in-Chief to have this interview with you, and it's a pleasure. It's actually a really, really great opportunity. Thank you, ma'am, once again for granting us this opportunity to talk with you and to hear from your wealth of knowledge.
All right. Yeah. You're welcome.
Thank you, ma. So let's start from the very beginning. We'd like you
Okay.
to introduce yourself to us so we can know you better. So we can know you better.
Right. Okay. My name is Dr. Biama Onya, the Chief Consultant Family Physician and a board certified lifestyle medicine physician. I happen to be the founding director of the UPTH Lifestyle Medicine Center.
Wow, wow, wow. Thank you so much, ma. Founding director of
Yes.
Lifestyle PTA chapter. Okay, what inspired you to start medicine? Let's start from the roots. What inspired you to start medicine? Given all the other different opportunities that there could be, what actually drove you to say, yes, this medicine is what I'm interested in?
Okay. Fine. So let me start by saying that I thank you guys for honoring me. I saw the letter that you had sent to me earlier, you know, thanking me for all the things I've done, the mentorship and all. And I would like to state that it's no coincidence. It is actually part and parcel of medicine, to show or to exhibit knowledge, long-term, lifetime learning, sacrifice, and service. So, my own journey wasn't a very typical one, in that I had actually wanted to be an artist. An award-winning artist. Yes, a fine artist. I'm great at art, and
Okay,
that's something my children inherited from me.
that's
Then
nice.
I'm also great at music. I'm great at modeling. I love fashion. So I
Okay,
didn't. I mean, medicine was just not on my mind. But of course, my parents and teachers felt differently. They said I was a smasher, which I was. I was always coming first, and
okay,
doing excellently well. And my teachers and parents wanted me to read medicine. They felt I shouldn't waste my brains, as they put it. So
okay,
I insisted on art. They said, no, 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 we're not going to pay for you to be a fine artist. We're not going to pay. We're not sponsoring you. So I had to do medicine. Yeah, I wasn't really into it, but along the line, ego sets in. You're like,
yeah,
no, I'm not gonna fail. I have to succeed. This is me at the end of the day. It's not them. So
true, true.
I had to do what I had to do. Did excellently well, and by the time I was through with med surg at the University of Nigeria, I my lecturers actually wanted me to do residency. They said I shouldn't waste my brains. See the same language. Don't waste your brains. You better do a residency training program. So, okay. So, a lot of them wanted me to go into their own areas. ONG. I know Professor Guano, he wanted me to do ONG. He said I was brilliant. Internal medicine, they wanted me to go into pediatrics. I said, no, no, no. I don't want anything that is just single. I don't know if it was just me. I think I just wanted a holistic view, because I had gone through all the departments, all the specialties, and I realized that it was not very interesting to just sit in one place. I'm DEI, yeah?
Okay, do it, do it.
Diversity, equity, and inclusivity. All right, fine.
Okay.
So I wanted diversity, and I didn't know how to go about it until I went to Echo Hospital for my what would you call it, internship? No, it wasn't internship. It was like postings. When you finish your second MB, third MB, and you don't have any other people are doing receipts. You just I just went there to
Just
do
get
some
familiar with
practice.
the
Yeah,
system.
familiar with the system, surgery. It was actually a surgical posting. And then they now told me that there was actually something called general medical practice, or family medicine as it was renamed later. And I was urged, to go and do the primaries by the joint CMDs. And there was, first attempt, there were, I think, 100 people that took that exam, and I was among the 20 that passed the primaries.
Oh, wow,
And
wow.
so I got admitted, to be one of the residents at Eco Hospital. Then my husband relocated to Port Harcourt, and I had to relocate along with him. So I came to University of Port Harcourt Teaching Hospital.
Okay.
And yeah, I actually finished, finished well. I was actually billed for best graduating. But there was a candidate that had got, I think he got half a mark more than me in the following exam. I went for the April exam before he went in October. And so when they did that, I don't know why they do these kind of things. They said, okay, I wasn't. But anyway, the point is that everybody knows that I was billed for best graduating. And to me, that's really fantastic because while I was doing residency, I'd even started our, my own brand, fashion brand, Neckers Talk. Yes, I had actually started it. I was quite successful at it. I collaborated with City People, and the first fashion show that they organized here in River State, in Port Harcourt, was in collaboration with me. So it was really a beautiful outing, and I enjoyed myself thoroughly. And it didn't stop me from raising my kids. I have 3 kids who are medical doctors and who graduated with distinctions.
Congratulations.
So what am I trying to say now? Medicine has been great so far, yeah? And from the perspective of lifestyle medicine, because I'm a lifestyle medicine physician, I'm actually very passionate about it. I think we're not paying so much attention, a lot of attention to preventive care, to making sure people actually don't get these chronic diseases that they actually suffer from, because we don't even have the money, the means, to treat them. Yeah. So that's one thing. Then leadership is another thing I'd like to, implore you guys to pursue, because you are the next set of doctors, people who are going to take care of our healthcare, you guys. And therefore, you need to get the leadership part right. You know that there's been leadership crisis, but you guys have to get this leadership part right. And therefore, you have to not just focus on skills, but also realize that you have to be innovative. You have to embrace the latest technology, artificial intelligence, and you also have to have compassion, very important, and build a healthcare system that is sustainable and that is effective, to ensuring that there's universal health coverage. So having said that, I would like to thank you for your time and for listening to me, and I hope that in years to come I'll meet you guys and you guys will tell me how far your journey went. Thank you, and God bless.
For those hearing about lifestyle medicine for the very first time, how would you describe it to them?
Well, lifestyle medicine. Lifestyle medicine is medicine, right? It's driven by physicians. It's a physician-driven specialty. Yes, and it has to do with not giving drugs and surgeries, but applying lifestyle therapeutic approaches, right?
Okay.
Which are evidence-based. That is the key word. Catchword: evidence-based. Yes. Okay. And of course, there's level 1 and level 2 evidence that these therapeutic interventions could actually prevent, treat, and even reverse, in certain circumstances, chronic diseases. Wow. So it's where we ought to be, considering where we are, in terms of double burden of disease. So we need to be able to revolutionize our practice by incorporating lifestyle medicine in our care. Okay. That's basic.
So basically, lifestyle medicine is revolutionary.
We need to revolutionize our practice by incorporating lifestyle medicine in our care. It's not enough for you to say, okay, can you go and take these drugs? Can you do these surgeries? Because oftentimes people can afford them, and we don't even have that level of care anyway. So why not, if lifestyle cost it? Because WHO has shown that all these chronic diseases, 80% of them, the risk is attributed to lifestyle causes. So if lifestyle caused it, then lifestyle should definitely cure it. I mean, that makes sense, doesn't it? These are low-tech solutions. These are things we can do, and they're cheap. You can exercise in your home.
Yes,
you can eat fruits and vegetables. You can grow vegetables if you say vegetables are expensive. And even if they are expensive, the unhealthy stuff that you eat is even more expensive. So in the long run, you find that it's going to be more expensive for you to continue doing those things you've been doing all along, because you're going to spend more. You're going to be sick. You're going to spend money on drugs. You're going to be absent from work. You're the one who's going to have all the pain and all the suffering. So why not prevent it? Why not treat it? And why not reverse it through lifestyle interventions, which are evidence-based?
What are the biggest misconceptions you believe most people have about lifestyle medicine? Because judging by from all you said, you have really stayed and been groomed in this specialty. So what misconceptions do you see as
Okay,
immediate?
misconceptions are several. I've really practiced lifestyle medicine for 3-4 years, and I've realized that a lot of people feel that especially our physicians, fellow physicians, they feel it's not medicine. I don't know what they're talking about. If you're not giving drugs,
Drugs or doing surgeries.
or doing surgeries, then it's not medicine. So that's a misconception. Secondly, and I've already told you that it's it's evidence based. So I mean, and there's high levels of evidence. The highest level of evidence is level 1, and those ones exist. Then a lot of people also feel that it's for the rich, and I've told you already that it's not an elitist kind of thing. It is something you have to embrace, and you can do that cheaply. You don't have to have a gym membership. You can cook your food at home. Just get all those things: the fruits, the vegetables, the nuts, legumes, whole grains, and stuff. You can actually cook your foods, make innovative food choices, and avert chronic disease through that. Then, of course, stopping smoking and alcohol. These are the 6. I'm mentioning the 6 pillars of lifestyle medicine. I don't see how expensive that is. Then, what about stress management? When you do your yoga and all of that, when you do all those relaxation techniques, and all those kind of things. Go for vacation, spend time in nature, all those kind of things. How expensive are these things? Then when you also socially connect, because socially connecting also helps with the reduction of your stress, improving your longevity, it helps with your quality of life. It just, how is it expensive to meet with people, at gatherings? I don't see how expensive that is. So what are we talking about? What about sleep? Making sure that you have 7 to 9 hours of uninterrupted sleep. How about that? There are ways lifestyle medicine can teach you to do that, and then you find that you keep all these chronic diseases at bay. So what have I mentioned? Nutrition, exercise. What about exercise? We've mentioned exercise, nutrition, stress management, sleep, avoidance of harmful substances, social connectedness. These are the 6 pillars of lifestyle medicine, and they are cheap. That's it.
Thank you so much, ma'am.
Yeah.
Now, from what I have here, you have authored 2 books on lifestyle medicine.
Not 2, I actually have authored 4.
4?
Yes.
So that means my record is actually outdated.
Oh yes.
Okay.
Food
I'm
as
sorry for the
medicine, sleep as medicine, lifestyle medicine for the menopausal woman, and the lifestyle medicine micro tracker for the menopausal woman.
Wow.
Yeah.
I like the fact that it's very inclusive all the way down to menopausal
Yes.
women. Okay, now what inspired you to write these books, and what should readers expect as they learn from these books?
Well, what inspired me to write these books is actually the fact that there's need for people to actually understand what we're talking about. Webinars won't do it. Many people don't join webinars.
True. That's
They
very
don't
true.
come for
Very true.
lectures. I mean, how many people? We don't really have a lot of enlightenment going on in that area. And so I said, okay, fine. Why don't I author books so that people can actually access this information at whatever time they want to access it, So, and that was just the thought behind it.
Okay, thank you so much, ma'am.
Yeah. You're welcome.
Okay, so what has been your most rewarding experience so far in your practice of lifestyle medicine?
Well, it's interesting and really rewarding when you have patients who have had their chronic diseases reversed. Not just treated, but even reversed. And I've seen quite a few patients that have, experienced that, and that made my day. It made it all worth
Very
it.
rewarding, actually.
Yeah.
Thank you so much, ma'am. Have you faced skepticism from colleagues or patients about lifestyle medicine, and how were you able to handle it?
Well, naturally, because this is something new, and our people see new things, tend to look at them with a lot of skepticism.
Yes, very
There's that inertia. Some already know that this is the right thing to do, but they feel, I don't. There's no real need right now. I can still take my drugs. But you see, I see a lot of patients who have actually tried to do all these things, the orthodox medicine, and it's not working. So they are actually very receptive, yes, to the opportunities offered by lifestyle medicine. And those are my best patients, the ones that know that, look, there's no going back. and they actually do what is, you see, it's dose dependent lifestyle medicine. It's just like drugs, the more you take, the more you do the things you're supposed to do the right way, the greater the results will be. So it's dose dependent. So you find that those ones that feel they actually need it the most are the ones that, do all the things that they need to do. Those that just do marginal stuff, right, they get marginal results. It's dose dependent. So that's just...
Thank you so much, ma.
Yeah.
What opportunities exist for medical students and young doctors who are interested in lifestyle medicine?
Several opportunities. It's a global thing. Lifestyle medicine is a global thing. So if you get, if you're interested and you want to get certification, when you go out of the country, you actually have so many ways of making money. Yeah, so many ways.
Through lifestyle medicine.
Yeah, through lifestyle medicine. And then, of course, it even improves your satisfaction, because when you're managing these patients and you're able to incorporate lifestyle medicine into your care, you get better results.
Okay, so now, where do you see lifestyle medicine in Nigeria and globally in the next, let's say, 10 years?
I think it's going to spread. I think the message is already spreading. We've been helping to spread this message. A lot of people are interested. They're excited. That's one of our clients, by the way. Come and say hi. Oh, she's one of those that was very compliant. Say hi. He's asking me whether lifestyle medicine works.
Yeah, it works. I've seen the evidence of it. Living your life, controlling what you eat, not necessarily on drugs. And it has improved my life greatly.
Thank you.
Thank you so much, ma. Thank you, ma.
All right.
Okay. Now, what lifestyle habits do you personally prioritize in your daily living, especially when it comes to trying to handle this much
activities that are around me? Okay, you know what? Lifestyle medicine cannot be lifestyle medicine without you using those 6 pillars synergistically. You have to use them together. So if you say you're just exercising, you're not doing lifestyle medicine. If you say you're just going to eat fruits, vegetables, whole grains, legumes, nuts, seeds, herbs, you are not practicing lifestyle medicine. You have to have all these 6 pillars going on in your life together for it to be lifestyle medicine, because it has a synergistic effect. So 6 is equal to 100. That's it.
In lifestyle medicine, equals to 100.
I'm telling you.
Wow.
So of course, sometimes you may fall off the radar. Sometimes you may, be deficient in one of the pillars, but then you have to beef it up. You have to know that this is a problem and you need to work towards it to make sure you still have that synergy going on for you.
Wow. Thank you so much, man.
Yo.
Now, final question.
Yes.
We just want you to make a remark for medical students that are still in the journey, still trying to find their paths, and still trying to just find their levels when it comes to the entire ladder of medicine.
Right. You guys should... I'm really very happy about the steps you're taking to learn from people that you need to actually learn from. You have to have that. That's the importance of mentorship, the mentor-mentee relationship. So I encourage mentorships, and I encourage you guys to see what medicine is looking like, how the practice of medicine is right now, and what you can do as leaders to change that narrative, to change the landscape, the medical landscape. And, I also want you to incorporate lifestyle medicine in whatever you do, wherever you are. Think about what the patients eat, whether they exercise or not. You need to ask about their sleep, how they manage their stress, whether they're socially connecting or not, and whether they're taking harmful substances, which you should encourage them to stop. Thank you.
Thank you so much, ma.
You're welcome.
It has been a really, really great opportunity.
Yes.
Thank you so much.
You're
From
welcome.
the editor unit in River State Medical and Dental Student Association, even up to the level of the president, we say thank you. Thank you so much for this opportunity.
You're welcome.